I'm pleased to report, however, that 67% of our adult population officially ticked over yesterday have received their first dose of vaccine. To 8 p.m. last night, we had 1,164 cases of COVID. 3 people lost their lives, and we extend our deepest condolences to their loved ones.
I'm here with you today to share what it's like for intensive care nurses on the front line during this pandemic response. To keep everyone safe in our intensive care unit right now, we've essentially divided it so we can keep the COVID and the non-COVID patients separate and protect the most vulnerable. Intensive care patients need one-on-one nursing care. They need to be monitored really closely so that we can respond immediately in case they deteriorate. For our COVID ICU patients, they can't have visitors at all. Every day we're communicating with families over the phone and by video call to connect them. In the worst cases, at the end of life, we'll connect a call with the family and we'll hold the patient's hands and we'll provide as much care and comfort and support as we possibly can. We know this is really hard for families. This is really hard for us as well. These patients are some of the sickest we've ever seen. They require so much support and monitoring and physical care. We're in layers of PPE, sometimes for hours at a time. This is really physically hard work. The Delta variant is so contagious that we have entire family groups in our hospital. In some really tragic circumstances, we've had both parents of young children, so sick that they need to be ventilated in our intensive care unit and separated from their children. Sometimes they don't have extended family to look after these children, or the extended family is so sick that we need to make alternative care arrangements. This virus is literally ripping families apart. Many of our patients with COVID are young, they're normally fit and healthy. They come from a variety of backgrounds, but the one thing that they have in common is that they are mostly all unvaccinated. We'll be with you right through this, but we need you to be with us now. If you haven't booked your vaccine, please go out today and book that vaccination. Follow the health orders. Help us as your frontline healthcare workers to keep patients out of hospital.